Tonight's Health Edge viewer Sandra writes, I'm a diabetic with a BMI rate of 43. She says, I am in my 60s contemplating bariatric surgery to lower my risk of kidney and heart disease.
Question, has it gotten safer, and do you feel that early 60s poses a much greater risk?
Our chief health editor, Dr. Partha Nandi, is here now to answer that question for Sandra.
Yeah, great question, Joanne and Dave. I think that, bariatric surgery can really be helpful, especially for Sandra's case in treating diabetes. The surgery also can help high blood pressure and heart disease. But we have to remember that all types of weight loss surgery are major procedures and can have serious side effects. You should check with your doctor and ask what your risk is at any age, not only just at your 60s, but any age. But tonight, I want to take you on a woman's journey after she struggled with weight loss her whole life. Rhonda Likens always struggled with her weight.
Ever since I was a child, I was overweight. I was, the chubby little kid, and I always had to wear the pretty plus size when I was a teenager. And
at her heaviest, Rhonda was 328 pounds. After years of dieting and then gaining back the weight, Rhonda looked into weight loss surgery.
And they start teaching you things that you should eat, things that you shouldn't eat. And before I had the surgery, I had lost 40 pounds on my own.
Dr. Christina Lee of LifeBridge Health performed what's called a sleeve gastrectomy on Rhonda.
That is where you take the stomach, which holds about 1 liter, and you make it into, you take about 85% of that stomach out.
Weight loss surgery has been increasingly more popular. The American Society for Metabolic and Bariatric Surgery says doctors performed about 179,000 bariatric surgeries in 2013.
Most of the patients have tried the old-fashioned way, and that the average patient takes them a few years to get to that decision.
Dr. Lee says you have to be serious about making changes to your life, and now insurance companies are making sure you put in the work beforehand.
Insurance companies mandate usually a certain amount of time, 3 months, 6 months, of working with the dietitian in our program before they're allowed to have surgery.
Rhonda says the surgery was life-changing and the best decision she's ever made. Her size dropped from a 28 to a 12, and her life just keeps getting better.
I'm not afraid to do anything anymore. I'm back to enjoying my roller coasters, and I play with my nieces and my nephew. I can run around and keep up with anybody now.
That's a great story. I mean, it changed Rhonda's life,
Yeah,
So.
and I know you say it's not for everyone, but one thing I just want to bring up, working with the dietitian, so important, because it's not like you can just eat whatever you want after this surgery. You have to be careful after, right?
That's exactly right. The bariatric surgeons always tell me it's a tool.
Yeah.
So if those viewers are saying, you know what, is this going to just change everything? I can do whatever I want. It's not it. It's a tool, and you have to follow the lifestyle plan afterwards. And so, you have to see a dietitian, often a psychologist, along with the surgeon to really find out. So remember, there are complications that people can have. People can have blood clots, you can have infection, you can have bleeding. So there's a lot to this. So talk to your doctor and discuss if it's the right thing. But for Rhonda, it can be phenomenal. I mean, it changed her life.
Who is it for? I mean, ideally.
Ideally, it's for folks that are BMI that are high, like her. She had a BMI of 43, so they're obese. They have diabetes, they have high blood pressure, they have heart disease, and losing that weight can save their life. And so really it's a great tool, but again, I go back, it's not a panacea, it's not for everyone. So talk to your doctor, understand the risks, and understand you have to change your lifestyle with this tool.
Very good.
Good
Dr. Nandi,
information.
thank you.
Thank you.